would like to move on to our next speaker, Dr. Andrew Mendanza. He is the Health Program Manager, Substance Use Prevention with the Substance Use Prevention and Treatment. And he's going to give an opioid data update and overview. And Dr. Mendanza, he oversees clinical and program operations in the Sacramento County Substance Use Prevention and Treatment Unit. For over 15 years, Dr. Mendanza has been actively involved in the fields of substance abuse, mental health, and forensic psychology. As a nationally recognized clinical and forensic psychologist and diplomate in advanced clinical mental health practice, he has served as chief psychologist for the state of California Correctional System and has both worked and held senior leadership roles in various public and private healthcare and behavioral health systems. Dr. Mendanza currently serves as an expert reviewer for the California Board of Psychology Enforcement Division, where he opines on departures from standard of conduct regarding alleged professional misconduct. He has also been featured in countless national media, including Forbes, US Today, NBC News, HuffPost, discussing topics such as suicide, mental health, and substance abuse. So let's welcome Dr. Mendanza.
Great, thank you, everybody. And just wanted to, again, thank you. Everybody can hear me okay? I hope so.
Yep, we got you.
Perfect. All right, good. And I just wanted to, just share my condolences and thanks to you, Laura, for sharing your story and sharing, your journey and your passion. And, you have our support at Sacramento County and my unit's support. And I think anybody on this call, definitely whatever we can do to continue to, to move this forward and to use what was a tragedy to be an opportunity for many others. So I want to thank you again from the bottom of my heart. And so today I'm just going to be talking briefly on some of the statistics that are that have recently come out of the CDPH, the California Department of Public Health, California Overdose Surveillance Dashboard. Mark talked about some of the stats are kind of more real time, kind of from the coroner's office, and that's really great. I think what I'll review with you today is just going to be really supporting what Mark was kind of sharing with you and some of the trends that we're seeing. I only have about 20 minutes, so I'm going to throw a lot of data at you, and I'm also very much available after the call in for ongoing if you have questions about the statistics or where I got information from. But everything I'll share with you is available publicly on the opioid website. And for those of you that haven't seen it before, the website is right here on the skylab.cdph.ca.gov/OD-. And I'll put this in the chat after I get done as well, but it's great. You can look at both county and statewide data. If you can compare counties against each other, you can look at where counties fall within state averages, and it's very, very helpful. And over here on your left, you can see you can do a lot of different, you can draw data from a couple of different ways. So if you're really wanting to look at more current data, but for our presentation today, I'm going to be presenting the 2020 data. This is newly released data from CDPH, again, the California Department of Public Health. These are the folks that publish it. And I put it in the chat, but you can also search from not only overdose deaths, but you can look at ED admissions, so emergency department admissions, hospital admissions, and you can search by opioids as a chief complaint in hospital admissions or ED admissions. So again, that may help you, Mark, when you're looking at hospital data as well, in conjunction with some of the other recommendations that got brought up in the chat. But what I thought I would do is I'm just going to go over our state data real quick and then go into county data. And just a reminder, the data that I'll present, it is crude rates. So you'll sometimes see that, but basically it is a total number of events out of 100,000. So I'll give you some rates, and just a kind of a statistical term is just a kind of the crude rate, and it just means a number out of 100,000. So, and if you have questions on that, you want me to go in more detail as I'm giving the numbers, feel free to ask. But overall, statewide, 2020 had about 5,300 opioid-related overdose deaths in 2020. Our rate was about 13.52. and that represents about 120% increase from 2018. Synthetic opioid-related overdose deaths increased at an unprecedented rate, which is why we're all here and listening to our previous speakers. Most of that is represented by fentanyl. According to CDPH, the opioid epidemic remains a serious public health issue for California. And as we all know, it has become an epidemic for us, especially related to synthetic opioids, mainly fentanyl. In some 2020 November research that came out, looking at multiple states and kind of geographical or regional data nationally, we saw that the fentanyl-related mortality west of the Mississippi, so in the western United States, suggests that recent evidence from county and state surveillance rates found a collective contribution to national synthetic narcotics mortality increased 371%. So Western United States epidemic related to deaths increased about 371% between 2017 and 2019. So available 2020 data suggests an additional 63% growth in fentanyl mortality from 2019. So it's not just a California issue. We know this, and we know it's a national issue. It's affecting some states more than other states, but we are seeing west of the Mississippi is that we are under an epidemic from multiple states. So looking at the statewide data, this is basically, we're looking at death rates per 100,000. We know that there are some counties within California that are doing better than others. But looking at the chart version of this, basically, Sacramento County down here in the yellow is lower than the California average. So that's a good thing for us, but still, we are still certainly having issues and our numbers are still quite high, but we are falling below the California average, speaking just for California. Let me see here really quick. Let's see. Looking at deaths by race and ethnicity, looking at 2020 data, Native American and Alaskan Natives continue to be the highest in opioid deaths, followed by Black and African American, then white, down here in green, Hispanic and Latino, and then blue was Asian and Pacific Islanders. But we are seeing increases among our Native American and Black African American. So I know a lot of the prevention partners on the call today are doing a lot of work to really target different ethnic groups out there in Sacramento, and certainly the data suggests the need to continue to do that. Looking at age and gender, again, this is very similar to the data that Mark just presented from the DA's office. Not surprising, we are seeing the highest between our 30 and 34-year-olds, followed very, very, very closely by the 25 to 29-year-olds, 20 to 24-year-olds. So again, we're talking about plus or minus 1 or 2, splitting the difference between certain age groups. So again, if you kind of group these together, you're pretty much looking at an epidemic between, mid-teenage years all the way to 40, 50-year-olds. And again, this is just 2020 data. Mark's data from 21 from the coroner's office is showing that it's just about transcending any age group, from young teens all the way into folks in their 70s. And certainly the data supports that as well. And just more of an information graphic for you, males up here at about 20, females down here at about 5 or 6. So about a 4 to 1 difference between males and females on the statewide data. Moving into our Sacramento County data, which is probably what a lot of folks are interested in seeing here. Sacramento did experience, again, this is just 2020 data. Mark's data was more current on this. Sacramento experienced about 106 opioid-related overdose deaths in 2020. Our crude mortality rate was about 6.76, which represents a 50% increase almost from 2018. And again, even in Sacramento County, synthetic opioid overdose deaths was largely represented by fentanyl. Looking at our zip code data within Sacramento County, down here we have some counties that are significantly overrepresented in death data. 95615, the 5690 and 5811 account for a good chunk of the data, and then it kind of cascades down from there. Most zip codes, with the exception of I think 2 zip codes, had deaths in them. So again, this isn't something that's just a downtown issue, or that's a North Sac or a South Sac, or that's a high SES issue up in Folsom or something. As you can see, deaths are present in all zip codes with the exception of a few. And those zip codes have very small amounts of population, so not surprising. Looking at it looking at our ethnicity and race, again, very similar to our state data. African American they lead in deaths in 2020, followed very closely by white, and then Native American, or Native American were third. So if you can remember from the state data, Native American and Alaskan Native were actually first. So we are seeing Sacramento County slightly different than state data in regards to the Native American Alaskan Native. They're actually third in the county data. Over here on the rate, you can kind of see a breakdown a little bit more. Looking at age and gender groups, again, not surprising, in Sacramento County, almost tied. The 25 to 29-year-old and the 30 to 39-year-olds were the highest. But again, if you look at the numbers on the left-hand side, the crude rates, we're only looking at increments of 5. So really the difference between first, second, third, fourth, fifth, sixth, seventh place might only be a couple of deaths. So it's safe to say that, again, we're being affected in all age groups. But 2020 data did highlight that the 25 to 29 and the 40 to 44-year-olds were the top two. And you can see over here on the numbers as well, if you want to see a breakdown. Just in similar to what Mark's data was, we saw deaths in the 70-year-olds and all the way down. We didn't see any deaths in under 5. But not surprising, that likely that would be an accidental or some kind of a issue with kids getting into medications unintentionally or something like that. So not surprising there. Looking at gender, very similar. This here, females had a crude rate about 3, and males had a low crude rate pushing almost 11. So very similar. It's affecting males more than females. But again, looking at the numbers, females, some of the trend data that I was looking at some other states from across the US, seeing that females are slowly increasing and catching up with males in many states. So I would not be surprised in this presentation if we did this in a year or two from now to see females at a 1-to-2 or 1-to-3 ratio. They're certainly gaining ground on overdose deaths. And just again, that's just a really high level presentation on the state and county data. Here again is the website. I encourage you. You don't need a subscription. You don't need to log in. It's free. Click on that. You can sort by ethnicity, age, gender, all kinds of stuff. You can compare zip codes. You can look at ER data, hospital data. All sorts of information is really there, and it updates every few. It depends. I've seen data update in a couple of weeks. I've seen data update, several months later. So it's not real-time data. Unfortunately, I think they're getting better at that. But unfortunately, it is basically, it's the previous year usually on data. But towards the end of the year, 2021 data starts to creep in. So we'll start to see some 2021 data in some of these dashboards as the year goes on. So that's enough for me on hand it off. Is there any questions or any clarifications? All right, I don't see anything for me. So yeah, any other questions you have, feel free to email me or Lori, and we can certainly clarify anything for you.
Thank you, Dr. Mendanza. I was going to ask you, how would we email you?
Yeah, I'll put my information on there. I work with Lori and the SUPD team, so getting a hold of anybody in the substance use unit is a good starting point. They can always refer you over, but I'll put my email and my phone number in the chat as well.
I appreciate it. Thank you, sir.
Yeah, no worries.
Okay, thank you very much for that information, and always eye-opening when you see the numbers and the graphs, right before your eyes. And I'd also like to mention, Lori put in the chat, songforcharlie.org and the Meth Coalition website, letstalkmeth.org.